Dr. Hughes, can you talk to us a little bit about what the association is between fatty liver disease and metabolic syndrome?
Yes, I'd be happy to. Fatty liver is actually the increase in the amount of fat being stored in the liver. Now, there are several different forms of fatty liver. There's a more benign form of fatty liver disease where there's just fat and no biochemical reaction. Then there's the form of fatty liver disease where you actually have free fatty acids being stored. Those free fatty acids are similar to soap. Or free fatty acids will start to dissolve cell membranes in the liver. The dissolving of those cell membranes allows the leakage of certain enzymes from the liver into the bloodstream. This leakage is what then is responsible for an increase in liver enzymes. Typically, patients are coming to me because they've been found to have an increase in liver enzymes, and very oftentimes their viral markers for hepatitis A, B, and C are already negative. Once we exclude such things as autoimmune liver disease, we then will assess whether or not they have fatty liver. The association with metabolic syndrome is quite simple. Metabolic syndrome is based on the fact that there's insulin resistance. Insulin resistance is because of an increased level of carbohydrates in the blood. The body is not able to cope with those high levels of carbohydrates and therefore keeps pumping out more insulin to try and lower the blood sugar. Unfortunately, as parts of the body are trying to deal with the high levels of blood sugar, they become more resistant. They don't want to listen to the insulin. The pancreas, unfortunately, will continue to pump out more insulin to try and get the rest of the body to cooperate. Unfortunately, one of the side effects of insulin, or one of the other biochemical pathways that it controls, is also the ability of the liver to break down and release fat and to clear fat from the liver. So the association with metabolic syndrome is that there, first of all, is usually obesity involved, or at least a significant amount of being overweight or an increased body mass index of greater than 30. Second of all, you have more fat, which is then also being stored by the liver. And finally, you have an elevated insulin level that's preventing the liver from actually clearing fat from the liver cells. Now, while this can be a problem, it also is associated with patients who come in and say that they cannot lose weight under any circumstance. The primary treatment for non-alcoholic fatty liver disease with steatohepatitis and metabolic syndrome is going to be weight loss. Unfortunately, these patients are correct. They will have a very difficult time losing weight because of their high insulin levels. The body does not want to break down fat because the body already has too much sugar in the blood. By regulating how much food is being taken in and reducing the number of calories in a well-balanced and medically supervised way, and by taking such medications such as metformin, which will reduce insulin resistance, we can actually get the body into a situation where it can lose weight. Loss of weight will then result in a decrease in fat in the liver, which will then decrease the amount of enzymes that are being spilled over, and thereby the decrease in the inflammation in the liver. Why is this important? First, you will have a decrease in triglycerides and cholesterol over time. It will decrease your cardiovascular risk factors. In other words, you'll have less of a chance of dying of a heart attack or stroke. Also, fatty liver disease is felt to be one of the primary causes of cryptogenic cirrhosis. Cryptogenic cirrhosis means that somebody who has cirrhosis or end-stage liver disease with no identified risk factor. Why? Because as the liver becomes more and more scarred, there are fewer and fewer liver cells to store fat. So all that's left in the end is scar tissue. Then you require a liver transplant. Unfortunately, oftentimes these patients are cirrhotic and obese, and they make very poor surgical risks for liver transplant. In the end, if we can get on top of the insulin resistance early on before you become diabetic, before you have too much injury to the liver, we can make a significant impact on your life expectancy.
Thank you, Dr. Hughes, for your time.